can you comment on immediate reconstruction, whether it affects treatment with chemo or radiation? That's a common question.
That's a great question. So we never want the reconstruction to get in the way of the cancer treatment. So in addition to the surgery that's required for all breast cancer, some patients need radiation, some need chemotherapy. Sometimes the chemotherapy is done before surgery, that's called neoadjuvant chemotherapy, and sometimes it's done after. So yes, we never want a complication, whether it's from the surgery, the resection of the cancer, or the reconstruction. We don't want any wound healing problems to interfere with those additional treatments. So immediate breast reconstruction is still the gold standard because it allows us to preserve all or most of the breast skin and sometimes the nipple. And there's no getting that back. If you have a mastectomy and you go flat, there's some cases where from an oncologic or a cancer perspective you have to do that, but it's not common. So we want to try to preserve the skin. So the bottom line is that most patients heal really well. If we have a problem with wound healing issues or infection and we get to a point where the patient isn't healed enough to proceed with another treatment that they may need, chemotherapy, radiation, then the reconstructive surgeon would have to act to help fix the wound healing problem. So for an example, if a patient has an implant reconstruction and there's a wound healing problem and they're not healed enough in time to proceed with radiation, we just take the implant out and let the patient go flat and then do a reconstruction later. It's not common that we have to do that, but we're very aware of that and we don't want the reconstruction to interfere with the cancer treatment.